I want to thank the organizing committee for inviting me and for putting on really a great show thus far. I've really enjoyed the morning and the morning speakers. As Jim mentioned, I'm going to be talking about smartphone apps, specifically about the Smart Appetite project, and it's really going to be kind of the development and evolution of this app, which is trying to improve knowledge, decision-making, and behaviors. And like many people, my name's on the slide, but this is a very large project, which I'll list people's names later. I have no disclosure. I'm making no money. I'm a professor. So I want to start with the theme of food for health. This is a nutrition meeting. I don't have to explain to any of you that what you eat matters for your health. We do know that about half of all deaths in North America are linked to unhealthy diet and what we eat. Diets rich in fruits and vegetables and energy-dense, nutritious foods can help combat a lot of those things like obesity and type 2 diabetes and certain cancers, etc. So a lot of my work is on children and teens' health and well-being, and so we've done a lot of research on looking at diets, and in Southwestern Ontario, in our work, we've done thousands of kids, and we've shown that less than a third of all 18 to 14-year-olds are eating the recommended servings of fruit and vegetables per day, and that's even lower for 14 to 18-year-olds. On the other hand, over 3/4 of kids are drinking sugary sweetened beverages every day. And some other research by students in our university has shown that while only 41% of kids were packing a vegetable for lunch, 93% were having an unhealthy snack. So thus far, I think traditional approaches to combating poor diet really are not working. As a geographer by training originally, I've done a lot of work on environmental influences, and we've shown in many studies that the increased density of unhealthy food retailers, as well as food advertisements, they're higher in low socioeconomic status areas. And why does this matter? Well, we've shown that the increased exposure to fast food and convenience stores has been linked to an increase in unhealthy food purchasing, poor diet quality overall, and increased BMI, especially for youth. So we've also done a lot of work on retail interventions, and thus far, I think we've shown that retail interventions alone really are not enough to improve diets. So we have food deserts, new food grocers come in, new healthy food retailers come in. We haven't seen the changes that we're expecting. So what do we do? So what's the solution? What interventions can improve diets? In my house, the junk food is up on the top shelf. I'm too short, but even short guys like me can figure out how to get unhealthy food. So what we've developed is Smart Appetite for Youth, which is using smartphone technology to expand food literacy for improving purchasing, diet, and health. Now, this is an app that we've been developing over the past 6 or 7 years, actually, and originally it didn't start out for youth, but we decided to focus on youth because really lifelong eating habits begin in childhood with a sharp decline around adolescence, by the time kids are going to high school. We really need novel strategies to counter those unhealthy food environments targeting youth. We've shown that there's heavy concentrations of junk food sites in close proximity to high schools. And smartphone technology now is ubiquitous among Canadian adults and youth. When we first started the project, we had stats like 55%, 60%. Now we're into 93%, 98% of smartphones. And in fact, everybody in our region, every teen has a smartphone. And over the past, I'd say, maybe 5 to 10 years, maybe 5 years, there's been a lot of adult app studies, and they've shown some potential. But these are really unidimensional in nature. They really target one thing, one approach. So maybe like calorie counters and things like that. So how does Smart Appetite work? We use tip chains, and they target info to nudge users to make healthier, smarter choices. So what happens is we first of all, we actually ask you questions. We personalize the app, so we ask you little questions about your interests. Are you interested in sugar? Are you interested in learning more about gluten or dairy, etc.? And then we send you a customized tips. This one seems to be about leafy green and healthy oils. And to this tip is connected to a healthy recipe. And that healthy recipe then is connected to a nearby vendors that sells ingredients in that recipe. And then you click on the vendor and you'll get turn-by-turn directions to that vendor. And then afterwards, we ask you to rate that tip. Let us know how we're doing. So the idea is that it's a tip chain, so little nudges along the way, a little tap on the shoulder. So we're starting off with some information about something that you've already told us you're interested in, so whether it's vegetables or a vegan diet or something like that. We may send things about seasonality, food preparation, and nutritional content of certain foods. And all of that information is dietitian approved from validated sources, making it a little bit easier by telling you some recipes. And then, again, those vendors that sell that recipe. Go on. I didn't stick my timer on, so if I go too long, someone can. So what makes Smart Appetite so special? I'm a geographer, I had to have at least one map. So that idea of the specialized message chains, again, there are a lot of other apps out there, a lot of other food apps out there. But when we started this app, there might have been a tip app or there might have been a recipe app, but not the idea that we went from a tip to a recipe to where the vendor is to how to get it. And the fact that it's personalized, and this is something that is very, very important with apps now. A generic tip a day is not going to be enough. So we ask just a few simple questions. We do ask gender and age and postal code, and then these sets of 10 questions or 20 questions. And so yeah, personalization, very important. Temporally relevant, the idea is getting the tip when you want it. So we ask you to tell us what time of day you want these things. So when's breakfast, lunch, supper, etc. So what's the earliest you want it? What's the latest you want it? So when we were doing the practice version of the app, the very first time concept, we sent all the users 100 messages at 2 in the morning one time, and so it was they didn't like that. We had a lot of dropouts after that. So we realized that we have to have users want a program when they want the information, but also location relevant, and this is where the geographer comes in. So we use the GPS in the phone to let us know where you are. And then we have two types of spatial location-based messages. One, we have a location-based messages, which tells us about local food. So there we have, so we set a geofence, an invisible buffer around where you are. And if you get around the location. If you get within that geofence of M&R Orchards, for example, and it'll say M&R Orchards sells local apples at the farmer's market. So that's a buffer around the farmer's market. Or the root cellar has handmade butternut squash tortellini, etc. So we will send you some information about a local vendor. But also if you get in a buffer of a generic, a fast food restaurant that will not be named, but we may send something reminding you that did you know that the average fast food restaurant has healthy sides? Maybe you want to choose the salad. Or if you're going to order a slice of pizza, perhaps try the whole wheat crust, etc. So we will send nutritional tips that are not specifically related to a vendor if it may be an unhealthier site. So the idea is getting information about places that are in your community. And the idea is that it can actually introduce the users to a whole new food landscape, to some healthy retailers that are right around the corner from their house or if they're traveling. It's grounded in behavioral theory. I think that's an important thing. We're using behavioral economics and nudge theory. A lot of apps and a lot of work isn't necessarily based on behavior change theories, and I think when you develop interventions, you think about the theory of planned behavior or social cognitive theory, etc. So we thought carefully about that. And it's evidence-based and validated. So we have, I don't know how many now. When we started, we had one registered dietitian on the team, former student of Jim's, Colleen O'Connor. And now we have many registered dietitians that are on our team. So the food-based messages are all approved by dietitians from validated sources. So we're not just scraping information off the internet, as you can see on a lot of websites. This is all validated information. And same with our vendors. We get all the information from ground truthing and from government sources. Okay, so this has been a long slog. We first started in 2013. We probably started in about 2012 with developing this concept. And we tried a pilot study with 207 adults in the Western Fair Farmers Market in London, Ontario. It's up there on the top right. And we had a very small amount of money. We had $9,500 to develop an app and run a study and feed students. That was impossible. I don't know how we thought we could do something like that. But what we did was we built a messaging concept through smartphones. And we were able to run, I think it was an 8-week study, sending tips about local food and specials, et cetera. And we were able to show that we were able to nudge people to buying more vegetables, buying more local food, less prepackaged meals. And we had a really great qualitative feedback. So we decided that this concept is going to work. We're going to try to apply for more funding. So in 2014, 2015, with the support of Employment Ontario, actually in the former Ontario government, they funded this as a job creation tool. It was part of a labor market partnership project, the idea that we were promoting local food and we were trying to strengthen, direct people towards more local products and local vendors. So we held focus groups in 7 different counties with farmers and food processors and restaurateurs, et cetera, to talk to them about whether they'd be interested in participating in an app like this and whether they saw value in it. We did, there's some focus groups there, and we had an overwhelming appreciation and support for it. So we kept going. 2015, we did alpha testing and building buzz. We released an alpha version into the wild, and with bugs and all, and we've got a lot of attention from newspapers, et cetera. But it's still, we hired our first real firm to do it. Well, you know, it's had some bugs, and we had to go back and retool. Phase 4, we did adolescent focus groups. We were all ready to go in. We had some funding to go into high schools and do a study, but teacher strike. So we couldn't do any research in high schools that year. So we went and did, in 2015, so we did focus groups in the Y and the Boys and Girls Club and different community organizations, talking to youth, asking them what they'd like to see. And we ran all of our messaging by them, and we had them rate our messages for usefulness, interest, appealing. I can't remember all the different categories, but we had them rate all of our messages to tell them what they wanted to see. And we learned a lot. Like they weren't interested in seasonality, but they were interested in other things that were youth specific. So in phase 5 in 2016, we did a pilot study in one high school with 60 youth. So the lessons from that, we learned that we needed Android and social sharing features. It's funny because when we tried this out in the wild with adults, just general population downloading it, people were it was too much going on. A lot of adults said, this is very complicated. Whereas teens said, is this all it does? They wanted more stuff. They wanted to be able to tweet it out and do Instagram and connections, et cetera. And we also learned, we started out on an iPhone because it's very expensive to develop an app, and especially if you do it generic, or if you do it to one platform. At the time, iPhone had the market share. Apple had much more of the market share. But it was gradually becoming more and more Android, and Android was cheaper for kids, so teens were using Android. So we needed Android. And again, we learned that teens want messages specifically tailored for teens. They didn't want generic things about squash being in season in Ontario. They wanted things for teen health, teen nutrition, sports nutrition, even general healthy messages in general. So we added a lot more of those. What we learned from the 60, now it wasn't a very large sample size, but we learned that we can improve diet. We had increased consumption of fruits and vegetables, increased number of kids who were eating breakfast and packing their lunch. We had a lot of messages about that, about how much money you can save by packing your own lunch rather than buying, and a decrease in energy-dense, nutritious, poor foods and sugary sweetened beverages. So not statistically significant, it was a small study, but overall it was excellent. And we found that 80% of the kids said that the app had directly benefited them in some way, and 98% of the kids said that they would recommend it to a friend. So this was very positive and encouraging. One of the most important things, I think, was the focus groups and talking to them, and we had a lot of wonderful quotes, like this one from a 16-year-old male who said, "Smart app helped me be more aware of what I've been putting into my body and made me more likely to read the nutrition label on the back of the package." A 16-year-old female said, "I started to be more aware of the types of food that I am eating. I am also more focused and care more about my own health rather than what I physically look like." So it was quite positive. So we went back and we kept applying for funding, and finally, so for those focus groups, and the pilot study was funded by the Children's Health Foundation. And meanwhile, so finally we got that, and we applied for Heart and Stroke Foundation, and then eventually we got CIHR funding to do a very large 5-year project. In 2017, 2018, we've been redeveloping with new features and for multiple platforms. So now we do have Android, and we do have iPhone, and we do have the social sharing, and we added a few other little functions. Ever expanding evidence-based messages for youth. So I have a massive team. Over the years, I probably have had about 30 different undergrads from Brescia's Food and Nutrition Science program. Is anyone here from Brescia? No? Okay. Sorry if I don't recognize you, because there's been so many students who are working on it with the dietitians, coming up with messages. And also what's really neat, we've since added, in my lab, the Human Environments Analysis Lab, I have a youth advisory council, a 14-member group of high school kids that get together monthly. And they've also been helping us identify, they've been champions really for the app, champions in the schools, but also helping us identify what's cool, because, 50-year-old guy is not gonna know what's cool for youth. I do have 2 teenage girls, but they think I'm really cool, but okay. And we've been doing ongoing work to expand our vendor info. We're constantly updating the vendors. We've been doing research on assessing menu quality and items on the menu, and food ads. We took a photograph of every single food ad within 2 kilometers of every high school in the region. It's quite remarkable. So a student's been working on that, coding the food ads. And by finding out what's there and what's available in each one of these vendors, then we can actually develop those tips to target the healthy options. So even in the fast food restaurants that we don't want to promote the big multinational chains, we can still, again, give a little nudge, a little tap on the shoulder when someone's near them, just reminding them about healthy options. Okay. So we're in the middle of an ongoing intervention study that will run from, we started last year until 2022, 12-week intervention, looking at food literacy, food purchasing, diet quality of teens. We've already gotten about 800 teens in our study, and our goal is 4,500 teens across 18 schools, and these are socio-spatially stratified. So we'll stratify by urban, suburban, rural, and then food environments being, well, we're looking at the retail food environment index and looking at the quality of the food environment, and from poor to good. And half of the schools are control schools. So we're using pre-post surveys for the youth and for parents, and we are using the ASA 24 dietary recall. There's no platinum standard for food diet recall, but we've been using that. What's cool, we're doing GPS monitoring. So again, we have 2 types of GPS. We have GPS monitoring and then GPS recording. And so the idea, again, so we can send those location-based messages. We're going to be analyzing all the app analytics, and we're going to be doing more focus groups. Or we have been doing focus groups now. So, some useful tips. I was talking earlier at the break about apps, and everyone asked me, so I want to do an app, what do you think? So I think the first step you have to do is ask yourself, is an app really needed? And if so, are you the one to do it? Should you do this app? Do you think an app is needed? It's not easy, it's a long slog. And if you do, then I think you really have to use valid info informed by research. So do your homework before you do the app, see what's out there, and then also think about theories of behavior change. Think about the information that goes in there, not just scraping it off the web. It has to be valid information, and the validity of the information really retains your users. Multi-dimensional apps are most effective. Just like multi-dimensional interventions are most effective. I think when you have literacy involved in different aspects, I think that we've shown that apps that just do one thing don't retain attention very long. If that's only just the one thing you're trying to do. So again, it depends on what your purpose is, but if you're trying to do an intervention, it needs multi-dimensionality. And personalization as well. That's part of apps of the future, or of the current system now, is that everything has to be personalized. We are going to be working towards AI in being able to use things. For example, on the side there it says, how useful did you find this tip? Not useful, useful, favorite. Rating of the tips. Eventually we're going to try to build in algorithms that learn how people like which tips they like, and then we'll constantly send them more of those tips. I didn't explain that the tips, when you fill out the survey and about questions about you, we now code you on certain categories, these 20 different things. And then each tip is already coded on different categories. And then we match up the tip to you. So it always cycles through and picks from the best tips to send you. But if we can actually on the fly constantly change your likes and dislikes, then we'll always be able to perform new connections, make new connections between you and the tips. But we're not quite there yet with the AI. We are there with our algorithms on picking the best tips, though. I think you need to develop for both Android and iOS. You can also develop native apps for both of those. You can develop web-based ones that will work on anything. But we tried HTML5 and trying to work with anything, and it was too clunky, it wasn't as attractive, and too many constraints for research. So I think you have to think about your budgeting for that right away. And also as researchers, we have to really care about our data transmission and storage and ethics and security and anonymity, and we think long and hard about where our data is stored and how we do that process. I would say right from the beginning, plan for cost of extras and maintenance. It always costs twice as much as what you plan for it. And unfortunately, CIHR always gives you 30% less than you ask for, or any other funding. Sorry, I'm on camera, right? But it's hard to get funding for these type of things, actually, for research. But the reality is, it costs a certain amount of money, and also maintenance. The idea that you actually also have to have the technician there monthly to fix the glitches. Every 5 days I get something going on that I have to then say, okay, I approve you to spend that money to fix that thing because we're in the middle of a project. So you need to plan for cost overruns and think like a government, infrastructure project. It's always cost overruns. And develop a sustainability plan early on. I think you need to figure out how you're going to run this. Okay. How you're going to run this, how are you going to keep this going after the research funds are over? Okay, so what's down the road? That's a picture of exit 189 into London, Ontario. That truck probably was bringing fruits and vegetables back from the food terminal in Toronto. We were going to expand to additional regions. Right now we're Southwestern Ontario. We're going to go all Ontario, all Canada. We're going to do projects with special populations, so newcomers, pregnant women and breastfeeding women and pre-diabetic populations. And we want to have additional collaborators. So any of you out there from health agencies, food and ag agencies, any other researchers, we're happy to collaborate on projects. And so eventually, we're hoping someday exit 189 won't look like that. It will be filled with local food vendors and local products. And with that, lots of people worked on this project, and they're all wonderful students and co-investigators and collaborators. Thank you.
Thank you very much.